Trazodone, serotonin antagonist and reuptake inhibitor, increases serotonin release. Bupropion, NE and dopamine reuptake inhibitors. Venlafaxine and duloxetine, serotonin and NE reuptake inhibitors, used in patients that aren't responsive to SSRI and for patients that suffer from chronic pain as a symptom of depression. Mirtazapine, similar to SNRI but also antagonizes H1 histamine receptors, produces sedation, increased appetite and weight gain as side effects. Bipolar drugs. Bipolar equals cyclic episodes of mania and depression. Mania, due to excess excitatory neurotransmitters or deficit of inhibitory neurotransmitters. In bipolar, patient has episodes of excessive catecholamine stimulation and diminished catecholamine stimulation. MOA, exact mechanism is unknown. Alters levels of serotonin and dopamine. S/S of mania, insomnia, activity without fatigue, agitated, aggressive, overconfidence, seeking others, unusual interest in sex, substance abuse, denial of problem. A patient on a severe salt-restricted diet is susceptible to lithium toxicity. Increased intake of Na+ may reduce the therapeutic effects of lithium. Atypical antidepressants. Antipsychotic drugs. These drugs control psychotic symptoms, delusions, hallucinations, thought disorder. Used for schizophrenia, mania, and psychosis. S/S of schizophrenia, hallucinations, delusions, paranoia, indifference, detachment from surroundings, deteriorating performance of basic skills, withdrawal from social interaction, strange communication behaviors, irregular moods. Positive symptoms equal add-on to normal behavior, hallucinations, delusions, disorganized thought, communication. Negative symptoms equal subtract from normal behavior, lack of interest in daily activities, lack of motivation, lack of responsiveness. Typical antipsychotics include phenothiazines and non-phenothiazines. Block positive symptoms by antagonizing dopamine and serotonin. Side effects: anticholinergic, sexual dysfunction, sedation, orthostatic hypotension, weight gain, extrapyramidal effects, acute dystonia, akathisia, Parkinsonism, tardive dyskinesia, neuroleptic malignant syndrome, fever, muscle rigidity, unstable blood pressure, sweating, dyspnea. Contraindicated in Parkinson's, depression, bone marrow depression, alcohol withdrawal syndrome, Rice syndrome, COPD. Atypical antipsychotics blocks positive and negative symptoms by blocking dopamine, serotonin, ACH and alpha-adrenergic receptors. These drugs don't block the receptors as much as the typical antipsychotics. Equal less side effects. Drug group of choice. Side effects: weight gain, decreased libido, risk of type 2 diabetes due to altered glucose metabolism, bone marrow depression, few motor side effects. Contraindicated in epilepsy, leukopenia, depression, hypotension. Stimulants. These drugs treat ADHD, inattention, impulsiveness, hyperactivity. MOA, drug increases levels of dopamine and NE by blocking reuptake of dopamine plus NE. Stimulants shouldn't be used with MAOI. Side effects: risk of drug abuse, restlessness, tremor, insomnia, tachycardia, palpitations, arrhythmias, dizziness. These drugs should be given at least 6 hours before bedtime to avoid sleep interference. Patients should avoid caffeine as it increases the effects of amphetamines. Substances of addiction dependence, unable to stop taking drug due to satisfaction, pleasure from taking drug, linked to dopamine receptor stimulation in limbic system providing a sense of euphoria. Tolerance, higher dose needed to produce same response due to repeated exposure to drug. Withdrawal symptoms equal opposite to the effects of the drug. CNS depressants produce feeling of sedation, relaxation. Sedatives used for sleep disorders, epilepsy, anxiety. Barbiturates and benzodiazepines. MOA stimulates GABA receptors, which then inhibits brain activity. This is what causes the drowsy, calming effects. Overdose equal suppresses respiratory system. Contraindications: airway obstruction, narrow-angle glaucoma. Benzodiazepines produce more mild effects while barbiturates have more intense effects including dependence and potential for lethality. Benzodiazepine antagonist equal flumazenol. Barbiturates antagonist equal megamide. Opioids used for pain, cough, diarrhea, and anesthesia support. Sedation can occur after the initial rush, constricted pupils, respiratory depression, increased pain tolerance, analgesia, tranquility, euphoria. MOA. Opioids bind to mu opioid receptors on neurons in nervous system plus immune system, produces these effects: pain relief, mood alteration, euphoria and decreased anxiety, respiratory depression, decreased GI motility, cough suppression, pinpoint pupils, meiosis, pruritus. During withdrawal you give equal methadone, reduces withdrawal symptoms. When injected or inhaled, levels in the brain rise rapidly equal causing a rush. Ethanol, alcohol. Absorbed orally, detoxified in stomach by alcohol dehydrogenase. MOA, increases activity of GABA system. GABA is the major inhibitory neurotransmitter in the brain, decreases activity in nervous system. Effect depends on dose. Side effects: loss of motor coordination, slurred speech, sleep. Liver detoxifies alcohol at rate of 10 to 15 milliliters an hour. Long-term abuse equals cirrhosis. Cannabinoids. MOA, release of central biogenic amines including any side effects: dizziness, fatigue, slows motor activity, less coordination, paranoia, euphoria, food cravings, red eyes due to dilated blood vessels. Therapeutic effect: decrease pain and spasticity. Active ingredient: delta-9 THC. Hallucinogens. No medical use. MOA, acts on serotonin receptors in brain. Serotonin agonist, causes change in mood, usually euphoria, change in pain, perception, personality, sexual activity, feelings of intimacy, empathy. CNS stimulants increase in neurotransmitter NE, known as cognitive enhancers. MOA, stimulates NE equal increased CNS stimulation. Side effects: increase in blood pressure, increase in RR, reduced appetite, feelings of exhilaration, mental alertness, dilates pupils, abdo pain, irritability, headache. Immune, antibiotic/antiviral, and anti-inflammatory drugs. Bacterial infection drugs, antibiotics, classified by ability to live in oxygen, aerobic, anaerobic, shape, spiral, cocci, bacilli, and gram+/gram, is more difficult to treat. It is ideal to do a culture plus sensitivity to determine the bacteria you're dealing with before initiating therapy. Antibiotics can be bacteriostatic. ABX prevents further growth, reproduction, of bacteria, or bactericidal. ABX kills the bacteria. Penicillin used for gram-positive bacteria. MOA, bactericidal, drug binds to penicillin-binding proteins, which are involved in cell wall synthesis plus cell division equal prevents the proper development of the bacterial cell well. No cell wall equal membrane is exposed equal lysis of bacterial membrane. Side effects: skin rash, anaphylactic reactions. Contraindications: allergy to penicillin. These drugs can produce diarrhea. Take the drug exactly as prescribed. Complete the entire prescribed regimen. Drugs in this category: penicillin G benzathine, penicillin G sodium, dicloxacillin, cloxacillin sodium, amoxicillin, ampicillin, amoxicillin clavulinate. Potassium cephalosporins used for primarily gram-negative bacteria. First gen equals gram-positive, second gen equals intermediate coverage, more potent, more resistant to lactamase. Third gen equals broad spectrum, resistant to beta-lactamase. Fourth gen equals broad spectrum, can handle bacteria resistant to first and second generation cephalosporins. MOA, bactericidal, inhibits cell wall synthesis. Side effects: confusion, seizures. Drugs in this category: cefadroxil, cefazolin sodium, cefredin, cefaclor, cefuroxime sodium, cefdinir, cefixime, ceftazidime, cefepime hydrochloride. Tetracyclines used for a broad spectrum of bacteria. MOA, bacteriostatic, bind to 30S subunit equals prevent protein synthesis, required for maintenance of bacterial cell. Side effects: superinfection, abdo-distension, tooth discoloration of pediatric patients, impaired fetal skeletal development if taken during pregnancy. Contraindications: pregnancy, nursing, children under age of 8, kidney disease. Drugs in this category: dimeclocycline hydrochloride, tetracycline hydrochloride, doxycycline, minocycline macrolides used for upper RESP tract infects, lower RESP tract infects, skin infects. Legionella, chlamydia, listeria, campylobacter, opportunistic infections. MOA, bacteriostatic, inhibit RNA-dependent protein synthesis. Side effects: rash, fever. Drugs in this category: erythromycin, azithromycin, clarithromycin aminoglycosides used for, primarily gram-bacteria and resistant bacteria MOA, bacteriostatic. Bind to 30S ribosomal subunit equals prevents protein synthesis, also damages cell wall equals tends to be synergistic with beta-lactams not used during pregnancy or during nursing should not be given with other nephrotoxic drugs. Trough concentration must be at or below certain value to decrease risk of ototoxicity and nephrotoxicity. Side effects, neuromuscular reactions, ototoxicity, nephrotoxicity. Drugs in this category: amikacin, gentamicin, kanamycin, neomycin, streptomycin, tobramycin. Fluoroquinolones used for broad-spectrum MOA, bacteriostatic. Inhibit DNA gyrase and topoisomerase, necessary for DNA synthesis, equals DNA is unable to reproduce. Side effects: dizziness, abdo pain, fever, chills, blurred vision, tinnitus. Drugs in this category: ciprofloxacin, levofloxacin, moxifloxacin hydrochloride, norfloxacin, ofloxacin. Sulfonamides used for UTIs MOA, bacteriostatic. Alters folic acid metabolism, necessary for modification of bacterial proteins. Side effects: allergy, skin rash, crystalluria, oliguria, acute kidney failure. Drugs in this category: trimethoprim, sulfadiazine, sulfasalazine. Vancomycin used for MRSA, MRSE, gram-plus infections, C. diff, enterococci. Given PO for enterococci and C. diff, otherwise given parenterally. MOA, binds to and weakens cell wall equals makes cell membrane more susceptible to lysis. Side effects: hypersensitivity, eosinophilia, neutropenia, hearing loss, red man syndrome. Drugs in this category: vancomycin hydrochloride. Antiviral drugs. Synthetic nucleosides used for various viral syndromes including HSV and cytomegalovirus. MOA, interferes with DNA synthesis plus inhibits viral multiplication. Side effects: kidney injury, headache, hypersensitivity. Monitor kidney and liver function. Drugs in this category: acyclovir, famciclovir, ganciclovir, valacyclovir. Influenza A and syncytial virus. Drugs MOA, inhibits viral replication. Side effects: confusion, depression, fatigue, insomnia, irritability, and nervousness. Drugs in this category: amantadine hydrochloride, ribavirin, rimantadine hydrochloride, oseltamivir phosphate. Zanamivir. Nucleoside reverse transcriptase inhibitors, NRTI, used for advanced HIV infections. MOA, mimics thymidine equals reverse transcriptase, RT, incorporates it into DNA strand equals ends up being non-functional equals not incorporated into host DNA. Side effects: headache, fever, dizziness, muscle pain, N/V/D. Drugs in this category: zidovudine, didanosine, salcitabine, abacavir sulfate, lamivudine, stavudine, emtricitabine, tenofovir. Non-nucleoside reverse transcriptase inhibitors, NRTI, used in combination with other antivirals to treat HIV infection. MOA, direct inhibitor of RT equals prevents HIV replication. Side effects: hepatotoxic, monitor liver enzymes, skin rash, headache. Drugs in this category: delaverdine mesylate, efavirenz, etravirine, nevirapine protease inhibitor used for HIV. MOA, inhibit activity of HIV protease equals prevents cleavage of viral polyproteins. Side effects: kidney and liver toxicity, kidney stones, paresthesia. Drugs in this category: saquinivir mesylate, nalfinivir mesylate, ritonavir, indinivir sulfate, lopinavir. Lines of defense when there is injury to our body: first line of defense, innate immunity, barriers, antibodies, acid in stomach, things that prevent bacteria from penetrating our skin. Second line of defense, inflammation, vascular component, histamine, bradykinin, prostaglandins, and cellular component, neutrophils, monocytes/macrophages, antigen-presenting cells, lymphocytes. These are attracted to sites of injury by chemokines. Third line of defense, cell-mediated/specific, largely coordinated by T4 helper cells. This will connect with CD8 and B cells. They will use chemical signals such as interleukin-2. This will help to stimulate the proper B cells and CD8 cells. B cells produce plasma cells and memory cells. Plasma cells produce antibodies, IgG in particular, and memory cells prepare for the next situation of infection. The next time we see those antigens, we see a quick and large secondary response. Antihistamines block the effects of histamine on target tissues. Corticosteroids suppress immune responses and reduce inflammation. Immunosuppressants, non-corticosteroids prevent rejection of transplanted organs plus can be used to treat autoimmune diseases. Uricosurics control gouty arthritis attacks. Vaccines expose our immune system to small amounts of antigens so that it can create a primary response. Microbes that have been killed, organisms are intact but not alive/functional. Attenuated microbes, weakened thus cannot produce disease, alive but cannot cause disease. Toxoids, modified bacterial toxins that do not have hazardous properties. Pieces of protein or viruses have been isolated and can be used to create a secondary response. Contraindications, allergies to egg products, fever, concurrent infections. Antihistamines primarily block the effects of an allergic reaction/type 1. Hypersensitivity reaction. Histamine 1 receptor antagonists used for S/S of type 1 hypersensitivity, allergic rhinitis, allergic conjunctivitis, urticaria, angioedema, MOA. Drug competes with histamine for the H1 effector cell sites. If these cells cause S/S of allergic reaction, blocks histamine from its effects. The drug does not displace the histamine that's already bound to receptors. The following are the effects of blocking H1 receptor sites. Blocking action of histamine on small blood vessels, decreasing arteriole dilation and tissue engorgement, reducing leakage of plasma proteins plus fluids out of the capillaries less edema, inhibiting smooth muscle responses to histamine, blocking the constriction of bronchial, GI, and vascular smooth muscle, acting on the terminal nerve endings in the skin. That flare/itch relief of symptoms. Side effects, dizziness, fatigue, muscle weakness, arrhythmias. Corticosteroids, these drugs suppress the immune response plus reduce inflammation. Glucocorticoids used for adrenocortical insufficiency, anti-inflammatory, immunosuppressive, or antineoplastic activity. MOA, not entirely known, but these drugs suppress hypersensitivity plus immune responses. Side effects of these drugs affect almost every system. Insomnia, increased water retention, increased K+ excretion, suppressed immune response, peptic ulcers, impaired wound healing, HTN, increased susceptibility to infections, DM, hyperlipidemia. Do not administer live vaccines to PTS on large corticosteroid dose. Mineralocorticoids, these affect electrolyte plus water balance. Used for replacement therapy for PTS with adrenocortical insufficiency. MOA, act on distal tubule to increase Na+ reabsorption and K+ secretion. Side effects are similar to those of glucocorticoids. Immunosuppressants, these drugs are used to prevent rejection of a transplant. MOA, inhibit cell-mediated immune responses by different mechanisms. Do not administer this drug to a patient with an infection. Monitor for S/S of infection. WBC, fever, sputum, urine. Lifelong drug administration is needed to prevent transplant rejection. Side effects of bone marrow suppression, liver and kidney disease, infection, HTN, tachycardia, edema, reduced WBC. Weakness. Uricosurics, increased uric acid in blood gout. Normally, uric acid is excreted by the kidneys. MOA, reduced reabsorption of uric acid at proximal convoluted tubule of kidney increased excretion of uric acid in urine reduced uric acid levels. Side effects, headache, anorexia, GI pain, indigestion.